learners. Today we are going to discuss about the counseling psychology, which is BPCE 145, and we are going to discuss today Unit 1 Introduction to Counseling Psychology. What we are going to cover in today's class, like we'll see the objective of this class, what we are going to learn in this class. We'll discuss about the introduction of clinical psychology, counseling psychology, counseling, guidance, psychotherapy, and counseling. If there is a difference between these three. Then history of counseling, goals and objectives of counseling, personal characteristics of the counselors, and various types of counseling. Let us see what is counseling. So, counseling is a professional relationship between client and counselor. It is not any other type of relationship. Okay, only professional. No emotional relationship, no uh, family relationship, no other relationship. So sometimes what happens, patients say you are like my brother, or you are like my sister, or you are like my daughter or son. Okay. So counseling is not such type of relationship, and it does not enforce or reinforce such type of relationship other than professional relationship. So we'll see in a future other slides what is professional relationship. Counseling is done person to person. So one person is helping others. That is called counseling, and it can be done in group also. Counseling is goal oriented. There must be some goal to have sessions on counseling. So then some warmth should be there, permissiveness should be there. Like it's not like it should be done in a directive manner. So if patients or client want to share something, they can share. They can be permitted to share whatever they want to share, and counselor should be embedded. So a helping relationship between counselor and client, in which mutually decision and work towards goal that leads to solution of problems and client's growth and better adjustment. So this is basically counseling. So see, here you have to understand the mutual decision. So it's not like you are telling your clients that you do this, you can practice like this, you can study like this, you can sleep like this, so it will be better. No, some mutual decision you are discussing with that client, or client discuss his or her problem with you, and then you both come to some solution, or the how the problem can be solved, and how the client's growth can be ensured. So is it clear? So as I told you, the counseling is based on professional relationship, means you are meeting for the person for some purpose. So the purpose is to help out the person, no other purpose. So if there is other purpose, then it can't become a professional relationship. So the purpose of counseling is to empower the client and allow personal growth, both mental and physical. So this is the job of the counselor, to keep eye on that if there is growth or no. If there is no growth, he has to or she has to rethink about the approach which they are using for counseling. And it definitely helps in resolving adjustment issues. And counseling involve basically diverse and multicultural process, and it uses, like if a person is from different gender, caste, religion, culture. Okay, so the counselor should be well versed with dealing with those issues related to specific gender, caste, cultural, religious issues. He should be very aware about all those things, and must be sensitized about those things. Let us see what is guidance, because sometimes these words are used interchangeably: therapy, counseling, guidance. Okay, but they are different. So let us see what is guidance. So guidance includes personal, social development, career development, growth and adjustment, relationship between unequal, based on client's attitude, interest, and personality. Clients and their demands and wishes are at the centers, mostly information giving and remedial in nature. So basically, guidance focuses on personal and social development, career development. Suppose the child adolescent in class 10. Okay, he is going to appear in the board, and before that, he has to decide what he is going to take in 11: science stream, commerce stream, arts stream, any other subject, and what type of subject, different subjects he can take. Why? Because we have to see here the aptitude of the child or the adolescent. So you suppose that there is no aptitude about mathematics or calculation, and if you say that he has to study maths because there is a good prospect, he can become engineer, no, all these things will affect negatively. So that is one thing. Another thing, what type of career the person should select. So he would be a great engineer or doctor or a chartered accountant or a teacher or a historian or a anthropologist or psychologist or social worker. So all these things basically dealt in guidance. So you are guiding the person who is in some crisis, not able to decide what subject or what type of things he should do. So the role of here the counselor is to follow the principles of guidance and guide the person. Then the guidance is also focused on growth and adjustment. Why? Because if the person is not guided properly, so the growth may be hampered or person may not adjust. For example, if the student does not have interest in social studies and the parents are forcing, or language, for example English or Hindi, and the parents are forcing the student, no, you should read this or you should study these subjects in 11th and 12th. So the person, it will create adjustmental issues, and the the student may not have any growth in future. So that's why the guidance is required there. And basically it's emphasizes the relationship between unequal. It guides the people how to uh, develop relationship with those who are not equal. And it is basically understand first the aptitude, interest, and personality of the clients. Accordingly, guidance is provided. And whatever demands of the client and whatever wishes the client is having, it should be the main focus of the guidance. It is not like that other someone else is imposing something on the client. And guidance is basically maximum time the information given by the person who is doing guidance. So it's basically lots of information related to the client's aptitude, interest, personality, and subjects are provided by the in guidance. So it's basically information based approach. And if there is some other problem, for example, the person does not find himself mm, in a comfortable in a particular stream, so it have remedial nature also. These things can be changed or can be discussed and improved. Let us see what is psychotherapy. So basically, psychotherapy is also professional relationship. It's not personal or emotional or social relationship. and it basically focus on the changes in maladaptive behavior or thinking process. So psychotherapy is basically dealing with the problematic behavior and thinking, and it is applicable in psychological disorder or mental health problems. So if there are some disorders, psychotherapy is required. Just counseling or guidance will not do. And almost all psychotherapies are uh, prolonged in nature, means there are lots many number of sessions are required. Why? Because the problems are not minor, they are deep rooted problem. Okay, and they are disorders, so they require at least uh, 20 to 30 sessions to work upon the issues or problem. So we should know that ki psychotherapy should be done by a trained professional who is trained in psychotherapy and having license, can deal with mental health issues. And psychotherapy is generally delivered in hospital setting or clinical setups. So it is not like it can be done anywhere. Okay, there should be a proper setup where confidentiality and other things can be maintained, and the setup should be well established. So it's not like you can do psychotherapy at any place, anywhere. No, you can't. Let us see the process of counseling and psychotherapy. So these processes are common in counseling and psychotherapy. Let me again emphasize that psychotherapy is basically required for psychological disorders or issues related to mental health. Okay, issues related to stress and other things, which may affect the person's mental health. So, for example, marital relationship. If there is a marital discord, psychotherapy may be required. But when the problem is milder in nature, there is no diagnosis, and there are issues, adjustment issues, coping issues, problem solving issues. Okay. So there you can apply counseling. But if there is a diagnosis, person should avoid counseling. The psychotherapy should. And we'll discuss in further slides why it is not done with, why counseling is not done with the mentally ill or in mental health issues. So what is the process? Basically the process of counseling and psychotherapy is more or less same. Rapport formation, it starts with rapport formation. Rapport is basically you are making the client comfortable. You are discussing on a neutral topic. Neutral topic doesn't mean you are talking about the weather or the political issues. No. Neutral topic means topics which are related to the person or his family but not related to the problem as such. So first you are talking about the neutral problems, how you have come, who are there in your family, what you are doing, like such questions. Rapport is also formed on the basis of showing concern. So you should know how to show concern. So if you will not show concerns, so the rapport may not be developed. Okay, so after rapport formation, you start initial interview. Interview, how to start interview. So there are certain formulas which can be used to start interview. Like it starts with socio-demographic details, then chief complaint. What is the problem? Why the client has come to you? What are the issues he is having? Okay, since when these problems are there? When this problem started first? Was there any precipitating factor behind this problem or associated with this problem? And these problems were continuous or episodic or acute or insidious in nature. So all these things should be decided in initial interview. Then there is a like another performer which is called case history taking and mental status examination. So mental status examination may not be necessary in counseling setup, but in psychotherapy it is required. So then you are asking about the history of present illness. You are inquiring each and every symptoms, how they developed, what happened, what type of problem he faced due to those symptoms, and was there any symptoms resolved or all symptoms are still there. Okay, some new symptoms are added to this symptom. So all these things related to the chief complaint should be elaborated in history of present illness or present problem. So then you have to see that these symptoms have how these symptoms have affected the person's biological functioning, psychological functioning, social functioning. So biological, personal, and social functioning. So biological functionings are like sleep, appetite, bowel movement. So they were normal or disturbed during this manifestation of symptoms. Okay. Then personal, like the person is taking care of self, maintaining personal hygiene, and doing his job and other things regularly. So his routine was affected due to these symptoms or not. That must be recorded under social heading, like the how the person was interacting with others. Was there any change? He used to become aggressive or irritated while talking with others. So all these things you have to note down under history of present illness. So then it will give idea that how severe these symptoms are. So if the biological, personal, and social functioning are affected more, it means the symptoms are severe enough. Okay. Then you have to inquire about certain past. Is was there anything similar to happened in the past, or some other illnesses happened in the past? Then treatment stage. The patient was taking some treatment, or the client was taking some treatment, or not, and family history, how who are there in the family, where they live, what are their age, how are their health, all about all family members, and how they are related with the uh, patient or the client. Are they closely related, or they are just they are having arguments, or the relationship is strained? So all these things should be mentioned in the family history. Then you can inquire about the personal history. Personal history is related to early childhood development, academic history, or then the social history. All these things can be written in the personal history. When the schooling was started, how was it in the study, or if the person was not going to school, or homemaker, or never went to any school. So all these things should be. Then marital history also, you can, in case of adult, when they got married, how many children they are having. All these things are part of personal history. Then another section of also there in case history taking, pre-morbid personality. Like how was this person before the development of these symptoms? Okay, so was there any change? Like earlier the person was cool, now the person is aggressive. Earlier the person was very good in interaction, now the person gets irritated. So earlier the person was mixing with others, now the person remains aloof. So all these things should be written in your personality. Then in some cases you should know, like it is related to basically in psychotherapy and related to mentally ill, like mental status examination, where you write the general observation of um, and behavior of the patients. Then you write about the speech, you write about the mood and affect, you write about the thinking process, were there any delusion, or were there any extreme disturbances of formal thought disorders or possession. So all these things you write about the thought, then you write about the perception, is there any history of hallucination or at present the person is having uh, hallucination. Then you inquire about the general intelligence, attention, concentration, aptitude, judgment, abstraction. So all these things can be inquired, and you can mention about in the last about the insight. Is the person aware about the symptoms which he is having or denying? So it's on the basis of that you write about the insight. There are different various grades. We are not going into detail about these grades, but these things basically must be written with the counselor or psychotherapist. All this information, because your planning of the session, selecting the particular type of technique, will all depend on these information. So this is very much important. Then you can, being the psychologist, you can use some tools also, tests also, to understand the person's personality or quantify the psychopathology. For example, in case of psychotherapy, the person is having depression, you can administer BDI or Hamilton depression. So if person is having anxiety, you can administer some tools. If you think the person is having psychotic symptoms, you can use Rorschach or TAT or draw percentage. So it will basically gives you lots of information about the patient, and it's not necessary that you are only asking from the client. You can ask these informations from relatives also, those who are accompanying the client. But while you are doing the test, try to do separately, not in the presence of client, not in presence of client's relative, until unless it is required. For example, in case of patient is having psychosis or violent, or patient is a geriatric person having dementia, then you need the relative should be seated behind the patient. Then after all assessments, you there is identification of issues and concern, what bothering the patient much. Then you explore and identify the goals. So here you have some idea. For example, there are marital discord. So they have come. The couple has come for counseling. So here you have to explore the goals. What should be the goal? And identify it. Okay. So this exploration identification should be done with the interaction with the client, not only just you are deciding, and you telling them also, okay, this will be the goal. Then you try to resolve the issues or concern, so you achieve the goal, and then you plan future course of action, okay, what it will be done. In most of the cases, we do not just terminate the session, we fix some follow-up sessions. Like the counseling was done weekly basis, so we can have follow-up on monthly basis, and then after few visits of monthly visits, we can terminate the counseling session or psychotherapy session. So in each steps of this process, you must take caution, and nothing should be done in a hurry, even termination. Okay, so you should be aware about all these things, and then you can have plan counseling. So this is very simple, like repo formation, then initial interview, possible assessment, then identification of issues or concern or problems, then exploration and identification of goal, then you are resolving the issues or concerns or problem, then you attain the goal, then future course of action was discussed, follow-up was planned, and termination. Okay. So let us see the historical perspective of counseling. Little bit about history. So counseling was existed in one form or the another since very long time. Okay, we all know that in Bhagavad Gita, um, Bhagwan Krishna has uh, a long discourse with Arjuna in Mahabharata. So it was a form of counseling. He was describing so many things, discussing so many issues, and resolving so many doubts of Arjuns. So basically, in earlier days, it was mainly in an advising form or guiding form. So there was less importance given on the mutual or both like client and counselor should discuss the things and decisions should be taken on a consensus basis. Earlier it was just like advising, giving advice, guiding the students or disciples or the person who is in problem, helping them, providing care and comfort. So earlier, because the techniques which we are using now were not used earlier. So it the counseling was developed as a distinct profession in 1940s, where advice, guidance, and providing information was the main focus, and the extension to psychotherapy. Like earlier, only counseling, then psychotherapies. But but see the difference. Counseling can be done with anyone, and- but psychotherapy can be done where the problems are severe in nature, where the diagnoses are there, mental health issues are there. But if problems, and in psychotherapy, most of the patients they require medication also. And counseling is interdisciplinary. Earlier time, anthropologists, sociologists, lawyers, philosophers, they all were engaged in counseling. In United States, it stemmed out of humanitarian concern, especially for people affected by industrial revolution in mid 80s. So there were three leaders credited for the development of counseling: Frank Parsons, Jesse B. Davis, and Clifford Pierce. Let us see in brief about these three. Frank Parsons, so known as founder of Guidance, established Boston's vocational bureau. So guidance is very much required in vocational training. So two essential factors while choosing a vocation, like knowledge of the work and knowledge of self, means you should know what are the skills you are having and what type of work is there. So if you have knowledge, so you can find out, okay, I have such type of skills and this job is suitable for such type of skills, so I can be engaged in this work. And true reasoning of the above two. So there should not be any misconception or doubts or false informations. And it is basically counseling based on rationality and moral values. So in that time, moral values were also emphasized in counseling. J.B. Davis advocated for moral values of hard work. In 1907, introduction of vocational and moral guidance into English language composition course was started, and the systemization of guidance program in public schools also started, and to help students understand their personality and become responsible workers in future. So the focus of the J.B. Davis was on the to understand oneself, one personality, and it started from various public schools. Whereas Clifford Pierce forerunner of mental health counseling, exposed deplorable conditions of mental health hospitals, and he has written a book on A Mind That Found Itself in 1980. So the focus of all three were in different areas, but and from there only the counseling started in US. Rapid growth in later half of 20th century. So counseling is very much required now and part of so many things. Increased ease of public access to counseling services and setting up professional bodies like American Counseling Association. So in America, it's like required for each and everyone. Now in India also we have like counselors in schools. It was given like there is an order that every school, public school, should have a counselor because there are lots of issues among the students related to interpersonal issues, their mental health issues, or their problem in family facing every day by them, like marital discord is there. So parents are fighting, and they have to bear this thing. So there is issues related to addiction. So all these things should be taken. Then there might be some issues related to difficulty in studying. For example, in case of specific learning disability, so the counselors are required. The IQ assessment sometimes is required. Personality assessment is required. So all these things basically needed in the school setup. So it will work as a preventive measure. Indian counseling movement originated in the form of vocational guidance, voluntary private agencies they have started. Battle Boy Vocational Guidance Bureau, Bombay, started in 1941. Vocational, it was started by a Parsi Panchayat. Then Bureau of Psychologists in Allahabad and Central Bureau of Educational and Vocational Guidance in New Delhi started in 1954. And the current trend is 1 year diploma course in guidance and counseling started by NCRT, and it's running successfully. Now let us see the goals and objectives of counseling. So what are the goals? As we have discussed, repo formation. If you not able to form the repo, you cannot do counseling. So you should know the skills how to form the repo. Setting up professional counseling relationship. So you have to establish the professional relationship with the client. So this is your job to establish professional relationship. So here means you are projecting yourself as a helping person. Okay, you can help the client. Moved from problem focused and remedial orientation to strength based and preventive approach. So earlier, when the counseling started, the main goal was just problem focused and remedial orientation. So what the counselor can do, like the counselor can first focus on the problem, solve the problem, then all those remedies be done. Then the counseling should not be stopped there. Then the counselor should move to strength-based and preventive approach. So in future, the relapse will be prevented, or the client become more integrated, more strong personality-wise. Okay, so three types of goals we generally discuss in counseling: immediate, long-term, and processable. Immediate means suppose the person is, for example, the person doesn't want to study, want to drop. So immediate goal should be to discuss about the what are the problem related to you know, uh, stopping the study or not going to school. Then long term, because this could be not going to school, doesn't want to go to school or not studying well, could be a result of some other issues. So in long term, you have to be focused on those things. So those issues should not bother the person again and again. So he can or she can study well, and the person become fully functional. So fully functional person is the long term goal of any type of counseling. Then another goal is process goal, achieving conducive counseling environment. So the process, how it should be done, so that environment should be conducive. There are diverse factors should be considered like contextual factors, client characteristics, nature of the problem, etc. Okay. Contextual factors basically in what context the problem started, and client characteristics related to personality, his behavior, the way the person established relationship with others, and then the what are the different problems the client is facing. So the essence of the goal is the free will and the right of the client. So here you have to like not imposing anything on the client. Even in case of addiction, you are not telling that you want that he you should stop. You can discuss the issue with the client and tell that it is his or her choice to keep continuing smoking or stopping. But you should have some discussion on this thinking what are the um, harm or benefits the person is having with smoking, and you should respect the client's right. You are not imposing your will or wish on the client. So even the client say, no, I am not agreeing with you. Okay, this is your opinion. There is no need to agree with me. If you don't want session, no problem. But whenever you need session, I am there to help you out. Okay, so you are respecting that. So what are the objectives of counseling? So the first objective is to facilitating behavior change. So we certain behavior which creates lots of problem. So how to facilitate behavior? What type of behavior should be changed? So any maladaptive behavior, any behavior which creates problem, any behavior which basically responsible for trouble for the person. So the counselor's job is to facilitate so the client can change or modify his or her behavior. Resolution of the problems. So whatever problem client has come with, it should be resolved, but there must be some resolution how the problem can be solved. Enhancing coping skills. Why it is required? Because in most of the condition, when client is in trouble, it is generally seen that client uses maladaptive coping, as we have discussed in earlier classes, classes on stress management and psychological disorders. So these unhealthy, maladaptive, or ineffective copings, basically they are the main culprit for maintaining of the problem. I've given one example in earlier class that if some like the person is working in a corporate sector, and since 3 4 days he is having disturbed sleep, so he is discussing with his friends, I'm not getting proper sleep. So they will suggest you, why don't you have a drink one peg of uh, wine, and it will have sleep. So the person thinks, yes, it's very effective. He has taken one peg of wine yesterday and sleep well. So initially, this approach solves the problem, but this is maladaptive coping. Why? because it is not going to solve the sleep problem in future. Because after sleep, the person has to take two pills to get the sleep, or there is a possibility of getting addicted to alcohol. So it depends on several variables, biosocial model. So the person is basically, if the person is addicted biologically or psychologically vulnerable, there is a chance of getting addicted to alcohol. So then the job of the counselor is to promote healthy coping skills. So like teach them to go for exercise, to do at least 1 hour of exercise, so you will have good sleep. Or if the sleep disturbance is related to some other psychological problems, for example anxiety, for example depression, so that you can plan counseling or psychotherapy for that. Counseling, the objective is also to promote decision making. Decision making means you are empowering your client to make decision and you help in decision making process. The objective also improving relationship of the client with others and facilitating client's potential achievement of positive mental health. So all these are objectives of the counseling. Let us see the characteristics of the counselor. This is very important because without these characteristics, it will be very difficult to become a good counselor. So self-awareness. The counselor should have self-awareness. The counselor should know about himself and herself. He should not be in a denial mode. Open to new experiences. Whatever experiences are having, he should not be very rigid or restricted. Okay? Open to learning new things. And if something was learned wrongly, so he should know how to unlearn those things. The the counselor should have the ability to empathize with others. So if the ability not there, he has to or she has to develop those skills. And let me remind you, empathy is not just like you are rephrasing and putting that. You should also concerned about the client's problem. So you are basically asking lots of questions related to client's problem. So this so that you try to understand, and when you will understand, it will be easy for you to empathize with the client. Help seeking behavior in case of dilemma. So it's not like that if you become counselor, you are doing counseling your own. No. Suppose in case of any problem you are facing, the client is not improving, or there are certain issues, or you do not know, or you have doubt what type of technique I should use. So in such case, there should be a group, like you can discuss with your supervisors, your teachers, your colleagues, or sometimes like you are reading your own notes and other things, which is also helping you in these things. Being aware of one's limitation. This is also very important. If you are not able to empathize with some particular type of problem, so you say straightforward, you can't see such problem. For example, if you think that you cannot empathize with the HIV positive, so no need to go in that field for counseling. But the best way is you should learn that skill. So how you can learn the skill? You have to read a lot. Like if you think you are not very comfortable with HIV positive, so read about HIV. So once you read, you will develop the understanding. Because why we are most of the time we are not comfortable due to our biases, prejudices about that particular type of issues. And high on the counselor should be high on self regard. So like the counselor should respect himself, respect his client, the sense of distinctiveness. The counselor is genuine, sincere, and honest. See, the genuine word is very important here. While you are doing the counseling, you are not doing drama. You are not just like somewhere I read counseling is a talk. It's not just talking skills. You should be genuine. Why? Because it is required. Otherwise, you cannot help the patient. You cannot help the client. So you must be genuine. And you should be concerned about the human welfare of the human being and ability to strike a balance between work and family. Carl Rogers has given certain qualities of the counselor or therapist, like sensitive to human relationship and objective attitude, unconditional positive regard. Sometimes counselors say, no, no, if you won't come on this time, I am not going to see you. So this is not the unconditional positive regard. And sometimes, like in case of addiction, they say, "Ki if you will smoke and come, then I'm not going to see. If you want to get cured, you stop smoking, then you come. Then we'll have sessions." So these shows conditions. So no conditions should be there. Counselor should understand himself or herself, her defense mechanisms, her personality, her behavior, and he or she should have in-depth knowledge about human behavior and personality. Otherwise, it will be very difficult to do the counseling. So, if you have not read lots of books on human behavior, personality, learning theories, it will be very difficult to become a counselor. Sensitivity to feelings of the client, trustworthiness, genuineness, empathy. So all these things must be there in a counselor, and it is not like all or none, or yes or no. Like the client is empathic or not. No, all these are on a continuum, 0 to 100. So you have to increase all these qualities if you are in the profession of counseling. Okay, you may not be very empathetic initially, but you start. You may not be very genuine, but you try to become genuine. Okay, so counseling competence is basically determination, facilitations, evaluation, and sustaining of positive therapeutic outcome. It consists each set of some set of competencies. Each competency consists of micro skills, both cognitive and behavior. So basically, if you have such type of quality, then you have to learn certain micro skills. Micro skills are basically the skills which helps you to deliver the counseling sessions, like establishing rapport, showing empathy, uh, your verbal and non-verbal behavior, your cues, giving cues to client or taking cues from the client. So all these things basically come under skills. So what is therapeutic alliance? Alliance is basically relationship between counselor and client. We all have relationship with many people, but they are not counselor relationship. Why? Because it is not a professional relationship. Affected by many factors, this therapeutic relationship culture, mental health stigma, self stigma, public stigma, motives of counselor, beneficial motives, harmful motives, level of insight in both counselor and client. So, if you are out of stigma and if your motives are genuine, so you will be able to maintain therapeutic alliance. Let us see the types of counseling. So there are three types of counseling: educational, vocational, and personal or social counseling. Educational counseling, as we have discussed, like from the it is generally done for the educational system. and it's like basically it may be related to various subjects, difficulty in various subjects, difficulty in study habits, developing good study habits, difficulty in recall, difficulty in attention, so all those things, and difficulty in learning particular subject. So the focus would be on effective learning strategies. Counselors should know that what are the effective learning skills, strategies, learning rather than competing. So the focus should be on the learning. See, last month you have learned this much. So your target should be at least same for this month, next month. Okay, so you are not competing with others. You are competing with yourself. So you are basically focusing on improving your learning skills, and your focus would be on the personal growth. And the education counseling deals with elementary students, high school students, college students. So in each and every setup, this education counseling can be conducted. Vocational counseling or career counseling, like it's related to choice of a career and deciding or pursuing a particular career. Okay. So it depends on the self-awareness. So that this counselor's job is to help the client to become aware about the self, what are the potentials, abilities, resources he is having, personality characteristics of the client, skill set, what are the skill set, what are the interests of the client, what are the aptitudes, contextual factors, and coping strategies. So all these things basically decide the vocational or career counseling. So the counselor job is to well verse in such issues. Whereas personal social counseling, it's basically growth and development of oneself and functioning in a social context. So it helps the person to develop self-awareness, achieve full potential, building better interpersonal relationship, and gain better emotional competence. So basically, the personal social counseling counselors basically help the person in social and emotional competence. So there are four types of counseling situations: developmental, facilitative, crisis, and preventive. Let us see one by one. So what is developmental counseling? So it is engagement in counseling is throughout the entire lifespan. It may be required for toddlers, for adolescent, for a geriatric population. Okay. So deals with various developmental stage related issues and concerns, empowering and gaining strength and aim at fully utilized one's capacities, encourages personalized learning. Okay, so no need to copy with how others learn, and gaining decision making abilities. In facilitative counseling, remedial or adjustive type of counseling, it is basically helps in progressing from deficit to functional stage, facilitates growth, helping the client to clarify the concerns and problems, promotes self-understanding and acceptance, suggest ways to overcome undesirable behavior or situations, overcome dilemmas related to jobs, marital adjustment, poor academic performance. Whereas crisis counseling is requires an immediate support, for example, in case of suicide. Frustration is commonly seen. Client is unable to cope with the situation's demand, and interpersonal dissonance, perceived inadequacies may be there, may lead to suicidal attempts, and primary goal is to reduce the anxiety of the client. So you have to manage the crisis situation. In preventive counseling, insight about like you counselor develop basically, or in the client, insight about his or her behavior, life choices and decision. What are the choices? What are decision? Drug abuse. Why the person decided to abuse the drug? Affected interpersonal relationship and career related dilemmas. So let us see the training in the field of counseling. So, four types of professional credentials imperative for counseling. Inspection, ensuring healthy practices of practitioners. Registration, the professional should be registered counselor. Licensing is very important. Certification, granting of recognition to the professionals in the field of in the respective field, and as I told, license. So government granting permission to the individual meeting prerequisites demand. So if things are not there, it will be very difficult to do counseling, because there will be, in case of litigation, the counselor may be in the trouble. So preparation and training in counseling. So academic preparation for understanding basics of counseling or psychology, then theoretical perspective should be strong, understanding human development. And practical skills are required, like hand skills and experience. So basically, the work should be supervised, and awareness and adherence to the ethical standards. Let us see the licensure and the scope of the counseling in India. So there is no central accrediting body or policy available at current moment for counselors. Rehabilitation Council of India and the Counselor Association of India are existent, but basically RCI is regulating the professionals who are working in the field of disability. So Government of India enacted National Commission for Allied and Healthcare Professions Act on 28th March 2021. So, but it is still in the process, like the how much time of training is required, supervision, who will supervise their work. So, lots of things are. So, at present in India, only like uh, professionals who are working in the disability, and like a rehabilitation psychologist and clinical psychologist. So only two types of psychologists are registered under RCA, and they have license to practice in field of therapy and counseling in related to mental health and other issues. So we all know that, as I discussed, in India this is a culture, like there in our culture, counseling. So in religious books also it's mentioned, and counselors in India works in schools. Like they have those who are working in schools, they have done guidance and counseling diploma from NCRT. Then if they are working in hospitals, so they have some training, or they are clinical psychologists. They are working in colleges to as a preventive counselors, and there are private counseling centers also. But counselors are not supposed to work on the mental health disorders or mental health problems, because for that they should have license. Otherwise, they will be there is a mental health care act, so they are punished under mental health act. So, like there is an area, and you confine yourself in that area. No need to breach the area, and largely female dominated profession, we all know. And basically the practice is basically focused on western theories, and in our country there are still genuine research are lacking, because very few people working on the doing research in this area. Maximum people are in practice. So what we have, so I end my presentation with this. What we have discussed today about the counseling. Certain skills are required for the counselor. And then different types of counseling we have discussed, and we have seen what is the licensing process in our country. And so those who wants to work in this field, they should get registered. Any council or any authority, anybody. Thank you.